Yeah, good day everyone. Today I would like to talk about when Iyana becomes life-threatening. Iyana, I think we've discussed it in one of our previous discussion. Iyana just means a swelling when there is a defect within any part of the body, especially in the anterior abdominal wall or maybe the the growing area when there is a defect there and the contents that are behind are protruding outside. Hernia becomes so dangerous when the pain becomes so severe and massive. When the patient cannot endure the pain, it becomes so dangerous. When there is consistent vomiting and the patient just keep vomiting, it becomes so dangerous. When the patient is unable to go to the toilet or is unable to pass through, when hernia becomes so complicated that leads to intestinal obstruction and the likes, hernia becomes so complicated and becomes so dangerous. Hernia becomes so dangerous and more complicated when there is incarceration or strangulation of the hernia. When it's a content that is supposed to slip in and out, slip in and out, then when it becomes stopped in that very place that is unable to go back to its normal position, that's what we call strangulation or incarceration of an hernia. It's unable to go back, it becomes incarcerated or strangulated, and as a result of that incarceration and strangulation, there won't be any good blood supply to the affected part of the body that got incarcerated or strangulated, that got herniated within that hernia sac. When there is no blood supply to it, that organ, especially the intestine, become necrotic or dead. And when it becomes dead, there will be loss of that particular part of the body, that part of that particular intestine that got stuck inside the hernia orifice. During the surgery, they have to cut off those parts. Those are the major complications. It becomes so terrible and becomes more complicated. Even most of those patients might end up having what we call anastomosis, that is, they cut part of that bowel off, then they join it together. And if that is not possible, there will be what we call colostomy, that they just bring some part of the other viable part of the intestine and they create a hole in the part of the abdomen that the patient will be able to pass feces from. Complication of hernia, it's not so good. When you have your hernia pain, the earlier the better before it becomes so complicated. God bless you.